NUR 355 Final Exam. Question 1. Which patient is most at risk for cholelithiasis? A 20-year-old male who exercises daily and strictly watches his diet. A 40-year-old female who has 5 children and has decided to use oral contraceptives. A 10-year-old female with newly developed hypotension. A 15-year-old male who has been experiencing periods of dizziness over the past few days and has not taken medication for it. The information included in this answer that indicates risk for cholelithiasis is the fact that she has multiparity and her use of oral contraceptives. All of the other answer choices do not contain risk factors related to calculi formation. Question 2. What is the pathophysiology of disseminated intravascular coagulation, DIC? This condition involves excessive bleeding and excessive coagulation as a complication of primary problems, which activate the clotting process in the microcirculation throughout the body. It is an isolated defect in platelet production in the bone marrow. It is a genetic deficiency of factor VIII leading to spontaneous bleeding. It is a localized inflammatory response isolated to the liver. This condition involves excessive bleeding and excessive coagulation. It occurs from a complication of numerous primary problems, which activate the clotting process in the microcirculation throughout the body. Question 3. Which of the following are primary conditions that can trigger disseminated intravascular coagulation, DIC? Hypertension and diabetes, asthma and COPD, osteoarthritis and osteoporosis, obstetric complications, like placental abruption, infection, major trauma, and cancer. The primary conditions causing DIC can trigger the release of tissue thromboplastin or injury to the endothelial cells, causing platelet adhesion. Examples include obstetric complications, infection, major trauma, and cancer. Question 4. What are the main complications associated with disseminated intravascular coagulation, DIC? Hypertension and tachycardia, weight gain and edema, ischemia, multiple infarctions, excessive bleeding, hemorrhage, and organ failure, hyperglycemia and ketoacidosis. Ischemia and multiple infarctions, excessive bleeding and hemorrhage, and organ failure. Question 5. Disseminated intravascular coagulation is a condition that is often life-threatening. This condition can arise from different physiologic problems. Which one of the answers below is not a primary reason for DIC? Extensive endothelial damage, release of tissue thromboplastin, hypertension from CVD, obstetric complication. Hypertension is not a primary reason for DIC. Extensive endothelial damage, release of tissue thromboplastin, and obstetric complications are direct primary causes of DIC. Question 6. Rheumatic fever is an acute systemic inflammatory condition that appears to result from an abnormal immune reaction occurring a few weeks after an untreated infection, usually caused by what organism? Staphylococcus aureus, certain strains of group A beta hemolytic streptococcus, Escherichia coli, Pseudomonas aeruginosa. Rheumatic fever is an acute systemic inflammatory condition that appears to result from abnormal immune reaction occurring a few weeks after an untreated infection, usually caused by certain strains of group A beta hemolytic streptococcus. Question 7. Which of the following are common manifestations of rheumatic fever? High fever, bradycardia, and jaundice. Low-grade fever, leukocytosis, malaise, anorexia, fatigue, tachycardia even at rest, and heart murmurs. Hypertension, vision changes, and tinnitus. Hemoptysis, chest pain, and wheezing. Rheumatic fever, low-grade fever, leukocytosis, malaise, anorexia, and fatigue. Tachycardia even at rest is common. Heart murmurs that indicate the site of inflammation, epistaxis, and abdominal pain possible. Question 8. What are the potential long-term complications of rheumatic heart disease? Chronic liver failure, acute heart failure from dysrhythmias and severely damaged heart valves that may need to be replaced. Pulmonary fibrosis, end-stage renal disease. Acute heart failure may develop from the dysrhythmias or severe valve distortion. Long-term, damaged heart valves may need to be replaced.